So we're going to get into mobilizing the scapulas in the side-lying position. The scapulas tend to get stuck to the rib cage throughout the day as we're very forward focused and we don't often move our scapulas around with our everyday activities. Now what you want to do is you want to place your thumbs along the medial border of the scapula. Make sure that the arm is in a slack position, and then you want to slowly push your thumbs underneath the medial border while hooking your fingers into the lateral border as well as the superior angle and just the top of the shoulder area. You can rock it back, loosening things up. If you want to come to the front, you can take your thumb and press it into the subscapular area and grab onto that medial border and just rotate that shoulder. Dig under that medial border, getting in to the scapula and moving it around. It's going to feel really good. Now here I'm just putting her arm all across my arm so I can have a little bit more mobility, and I'm going to mobilize the shoulder just a little bit more. This is going to give the scapulas a good stretch. It's going to give the shoulder a good stretch, and it's just going to get everything in that area moving. We're going to just continue rocking that scapula back and forth, just loosening up the area. Bringing it around in all the angles you can. Right now I'm pressing into the subscapularis a little bit deeper as her tissue is starting to loosen up and let me get in more. Now I'm just stretching the rhomboids as well as the mid-traps, as in the regular position for a massage, you're not able to do this. Here I'm just cross fiber frictioning with a little bit of linear friction along the ESGs. I'm looking for any crunchy points, tight points, and assessing the tissue to see where I need to spend a little bit more time. This will put more focus on those teeny tiny muscles that run along the spine, such as the rotators and the multifidi. Well, rotators or rotators, however you want to pronounce them. Sometimes you'll find little trigger points along here as well in the lamina groove. That's where I'm working in specifically. You can use points to stop and work on the rib cage as well to help open up the rib cage slightly, working in between the ribs and the internal and external intercostals. Now I'm moving more towards the quadratus lumborum. This is an excellent position to do work in the quadratus lumborum. I'll assess where the posterior iliac crest is and try to find the 12th rib, but just above the iliac crest is where the sweet spot's going to be. You come just laterally to the ESGs and you press down. So right now I'm just working along the ribs here. This is the general area where the quadratus lumborum is going to be. You'll be able to feel for the ESGs, and you'll feel the dip where the quadratus lumborum is accessible. Once I've treated that, I'll go up into the ribs, the lower floating ribs, and just work in there gently as the external obliques and the internal obliques attach around this area and can contribute to lower back pain. Side lying is one of my favorite ways to get in and work with the QL and help with lower back pain that way. It's also an excellent way to work on the psoas and the iliacus, but that'll be another video for another day. Now, I like to spend my time in the rib cage area. Not a lot of therapists work in the rib cage area. I'm just waiting to sink into the tissue and how I've been assessing the client's comfortability as well. You don't want to work too deep in this area, as cracking a rib would be bad, and it can be very tender in this area. And now I'm going to make nice with the area and move on.